Welcome back to Med School Radio. We are looking at some more educational objectives from one of the Q banks. Let's go ahead and get right into it. This is a good way just to make you remember the important parts of these MCQs. So I listen to these just to send these points home. Okay, let's go ahead, starting with aromatase. Aromatase converts androgens into estrogens in the ovaries, testes, placenta, and other peripheral tissues. Placental aromatase deficiency causes accumulation of androgens during pregnancy, resulting in ambiguous external genitalia in female infants and maternal virilization. Okay, so that was the first one. Next educational objective. Reperfusion injury is thought to occur secondary to oxygen-free radical generation, mitochondrial damage, and inflammation. That is reperfusion injury. Next, let's talk about atrial natriuretic peptide and brain natriuretic peptide. These are secreted by atrial and ventricular cardiomyocytes in response to myocardial stretching induced by hypovolemia. These natriuretic peptides inhibit the renin-angiotensin-aldosterone system and stimulate peripheral vasodilation and increased urinary excretion of sodium and water. Neprilysin inhibitors, for example, sacubitril, prevent the degradation of ANP and BNP, which enhances their beneficial effects in heart failure. On posterior anterior chest X-rays, the right middle lobe is seen adjacent to the right border of the heart, which is primarily formed by the right atrium. Consolidation in the right middle lobe can obscure the X-ray silhouette of the right heart border. Okay, let's read this again. We're jumping from subject to subject, so I'm going to read it slowly and try and catch it. On posterior anterior chest X-ray, the right middle lobe is seen adjacent to the right border of the heart, which is primarily formed by the right atrium. Consolidation in the right middle lobe can obscure the X-ray silhouette of the right heart border. Okay, next let's talk about botulinum neurotoxin. So where does that come from? Botulinum neurotoxin produced by Clostridium botulinum prevents the release of acetylcholine from presynaptic nerve terminals. The toxin impairs peripheral muscarinic and nicotinic neurotransmission, causing both autonomic symptoms, for example, fixed pupillary dilation, dry mouth, and skeletal muscle weakness, for example, diplopia, dysphagia, respiratory depression. Its effects at the neuromuscular junction can be seen on electromyography as a decrease in muscle response following stimulation of a motor nerve. So that is regarding botulinum neurotoxin. Next, let's talk about statistics. We love statistics, don't we? What is confounding? Confounding occurs when the exposure-disease relationship is muddled by the effect of an extraneous factor associated with both exposure and disease. Confounding bias can result in the false association of an exposure with a disease. Remember the blood-brain barrier? What do you know about that? The blood-brain barrier is formed by tight junctions between non-fenestrated capillary endothelial cells that prevent the paracellular passage of fluid and solutes. This barrier only permits the passage of substances from the blood to the brain via transcellular movement across the endothelial plasma membrane, which is limited by diffusion or carrier-mediated transport. Now, as you know, when you read these questions, they're asking you for one particular point. So if you can listen to these educational objectives, listen very carefully, because each factor, any one of these factors, can be asked on an MCQ. Do the same when you go over the NBMEs too. Read them very carefully and understand the concept. Next, let's talk about anti-glomerular basement membrane antibodies. Anti-glomerular basement membrane, or GBM, antibodies react with collagen type 4, causing rapidly progressive glomerulonephritis with glomerular crescent formation on light microscopy. Immunofluorescence demonstrates linear deposits of IgG and C3 along the GBM. This is characteristic. So again, I'm going to ask you, what are the deposits you would see along the GBM? IgG and C3. Okay, this is talking about anti-glomerular basement membrane antibodies. I'm going to read this one more time. Anti-glomerular basement membrane antibodies react with collagen type what? That's right, it's type 4, causing rapidly progressive glomerulonephritis. Rapidly progressive glomerulonephritis with glomerular crescent formation on light microscopy. Immunofluorescence demonstrates linear deposits of IgG and C3 along with GBM. This is characteristic of this. Okay, what do you know about tricyclic antidepressants? What happens when there is an overdose? This can cause fatal cardiac arrhythmias and refractory hypotension due to inhibition of what type of sodium channels? Fast sodium channels in cardiac myocytes. Okay, one more time. Tricyclic antidepressant overdose can cause fatal cardiac arrhythmias and refractory hypotension due to inhibition of fast sodium channels in cardiac myocytes. Okay, think about the upper motor neuron signs. Upper motor neuron signs include abnormal plantar flexion, the Babinski sign, spastic paralysis, increased muscle tone, clasp knife rigidity, hyperreflexia, pronator drift, and pyramidal weakness. So the weakness is more pronounced in the lower extremity flexors and upper extremity extensors. One more time. The weakness is more pronounced in the lower extremity flexors and upper extremity extensors. Lower motor neuron signs include flaccid paralysis, weakness, and hypotonia and muscle atrophy, fasciculations, and suppressed or absent reflexes. Okay, that was about upper motor neuron signs. Okay, next one. What is pulmonary actinomycosis? Pulmonary actinomycosis develops most commonly following aspiration and can be confused with lung abscess, malignancy, or tuberculosis. Microscopic findings include filamentous, branching, gram-positive bacteria and sulfur granules. Okay, that's regarding pulmonary actinomycosis. This happens after aspiration of something. So don't confuse it with lung abscess, malignancy, or tuberculosis. And on microscopic, you would find filamentous branching, gram-positive bacteria, and sulfur granules. All of these can be asked on a test question. What do you know about plasma homocysteine and thrombotic events? Elevated levels of plasma homocysteine are an independent risk factor for thrombotic events. Homocysteine can be metabolized to methionine via remethylation or to cystathionine via transsulfuration. Hyperhomocystinemia is most commonly due to genetic mutations in critical enzymes or deficiencies of vitamin B12, vitamin B6, and folate. Okay, so this is regarding plasma homocysteine. Okay, so remember here that for hyperhomocystinemia, this is due to deficiencies of what vitamins? Vitamin B12, vitamin B6, and folate. Okay, let's do another one. What do you know about pulmonic valve stenosis? What kind of murmur would it cause? Pulmonic valve stenosis causes a crescendo-decrescendo systolic murmur, which is best heard at the left upper sternal border and delays closure of the pulmonic valve, resulting in a widened splitting of S2. Inspiration increases blood flow to the right side of the heart, causing increased intensity of the murmur and even later closure of the pulmonic valve. So remember, the pulmonic valve stenosis causes a crescendo-decrescendo systolic murmur, and it delays closure of the pulmonic valve, and there is a widened splitting S2. So when there is inspiration, the blood flow to the right side of the heart increases, and this increases the intensity of the murmur, which is crescendo-decrescendo, and it causes an even later closure of the pulmonic valve. Okay, thanks very much for tuning in to this episode. I hope you got something from it. You know, when you don't have a lot of time to study, after you've done the MCQs, of course we have these educational viewpoints, but they get lost and you never see them again. But these are really, really important, because if you understand the concept basically and you understand those keywords, that's what's going to shoot out at you on a test and really makes the test easy. We all know that. So thanks very much, and I will see you next time.